Question 1. The control framework reveals that a radiation therapist is reviewing imaging for a patient undergoing external beam radiation therapy. The patient has undergone a CT simulation, an MRI for enhanced soft tissue visualization, and a PET scan to assess metabolic activity. The therapist needs to determine the most appropriate imaging modality to use as the primary basis for dose calculation and treatment planning. Option A. The MRI scan, due to its superior soft tissue contrast for precise tumor and organ at risk delineation. Option B. A combination of MRI and PET scans, as they provide more comprehensive anatomical and functional data than CT alone. Option C. The CT scan, as it provides the necessary electron density information for accurate dose calculation. Option D. The PET scan, because it offers functional information about tumor metabolism and potential spread. Correct answer is C. The CT scan, as it provides the necessary electron density information for accurate dose calculation. Explanation. Scenario analysis. This scenario presents a common challenge in radiation therapy where different imaging modalities are used for treatment planning and delivery. The professional must discern the primary role and limitations of each modality within the context of established ACT guidelines and best practices for patient care and radiation safety. The challenge lies in understanding how CT, MRI, and PET contribute to the overall treatment process, particularly concerning their impact on dose calculation and anatomical visualization, and how to interpret and utilize the information they provide accurately and ethically. Correct approach analysis. The correct approach emphasizes the fundamental role of CT in radiation therapy, specifically its necessity for electron density information required for accurate dose calculation. This aligns with ACT standards that highlight the importance of CT for treatment planning. MRI provides superior soft tissue contrast, crucial for delineating tumors and critical structures, but its lack of direct electron density data means it cannot be used alone for dose calculation. PET offers functional information about metabolic activity, aiding in tumor identification and assessment of treatment response, but it also lacks the electron density data for direct dose calculation. Therefore, integrating information from all modalities, with CT serving as the dosimetric backbone, represents best professional practice, ensuring both accurate targeting and effective dose delivery as mandated by regulatory and ethical considerations for patient safety and treatment efficacy. Incorrect approach is analysis. Relying solely on MRI for treatment planning without CT is a significant regulatory and ethical failure. While MRI excels in soft tissue visualization, it does not provide the electron density information essential for accurate dose calculations, leading to potential under- or overdosing of the target volume and surrounding healthy tissues. This directly contravenes the principle of delivering prescribed radiation doses accurately and safely. Similarly, using PET alone for treatment planning is unacceptable. PET's strength lies in metabolic imaging, not anatomical localization for dose calculation. Its lack of electron density data makes it unsuitable for determining radiation attenuation, and thus for precise dose planning, posing a risk of inadequate tumor coverage or excessive dose to normal structures. Prioritizing PET over CT for primary treatment planning, even if it highlights tumor activity, ignores the fundamental dosimetric requirements of radiation therapy and violates professional standards for accurate treatment delivery. Professional reasoning. Professionals should approach imaging modality integration by first identifying the primary purpose of each scan within the radiation therapy workflow. CT is the cornerstone for dose calculation due to its electron density information. MRI is invaluable for soft tissue contrast and target delineation, often fused with CT data. PET provides functional information that can refine target volumes or assess response. The decision-making process involves understanding the strengths and limitations of each modality, how they complement each other, and how to best utilize the fused information for accurate treatment planning while adhering to ACT guidelines for patient safety and effective treatment. This requires a thorough understanding of physics principles related to radiation attenuation and a commitment to evidence-based practice. Question 2. The assessment process reveals that during a patient's treatment delivery, the linear accelerator's beam output appears to fluctuate slightly, as indicated by the console's real-time monitoring system, though the delivered dose remains within the acceptable tolerance range for the current fraction. The therapist has confirmed the patient is positioned correctly and the treatment plan parameters are unchanged. What is the most appropriate immediate action for the radiation therapist to take? Option A. Ignore the fluctuation as long as the delivered dose is within tolerance and the patient is not experiencing any adverse effects. Option B. Immediately stop the treatment, inform the patient of the potential equipment issue, and await further instructions from the physicist or supervisor. Option C. Adjust the machine parameters to compensate for the perceived fluctuation to ensure the prescribed dose is delivered precisely. Option D. Continue the treatment as scheduled, documenting the observation in the patient's chart, and report the fluctuation to the medical physicist at the end of the treatment day. The correct answer is D. Continue the treatment as scheduled, documenting the observation in the patient's chart, and report the fluctuation to the medical physicist at the end of the treatment day. Explanation: the assessment process reveals a critical need to ensure the ongoing safety and efficacy of radiation therapy equipment. This scenario is professionally challenging because it requires a therapist to balance immediate patient care with the imperative of adhering to stringent regulatory standards for equipment performance. The primary challenge lies in recognizing when a deviation from expected performance necessitates immediate action beyond routine operation, without compromising the patient's treatment schedule unnecessarily. The correct approach represents best professional practice because it directly aligns with the core principles of patient safety and regulatory compliance mandated by the American Registry of Radiologic Technologists, AD, for radiation therapy. Specifically, it upholds the AD emphasis on quality assurance and the therapist's responsibility to report any equipment malfunction or anomaly that could impact treatment accuracy or patient safety. This proactive reporting ensures that the equipment is promptly evaluated and serviced by qualified personnel, thereby preventing potential under- or overdosing and maintaining the integrity of the treatment plan. This aligns with the ethical obligation to provide competent and safe patient care. An incorrect approach that involves continuing treatment without reporting the observation fails to meet regulatory requirements for equipment quality assurance and poses a direct risk to patient safety. This constitutes a failure to adhere to established protocols for equipment monitoring and reporting, which are fundamental to radiation therapy practice. Such an action could lead to a breach in patient care standards and potential harm. Another incorrect approach, such as attempting to troubleshoot or recalibrate the equipment independently without proper authorization or expertise, is also professionally unacceptable. This bypasses established safety procedures and could exacerbate the problem, leading to inaccurate dosimetry or further equipment damage. It also violates the principle of working within one's scope of practice and adhering to established service protocols, which are critical for maintaining regulatory compliance and patient safety. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and document any unusual equipment behavior or performance deviation. 2. Immediately assess the potential impact on patient safety and treatment accuracy. 3. Report the observation through established channels to the appropriate personnel, e.g., physicist, supervisor. 4. Follow established protocols for equipment downtime and patient management until the issue is resolved. This framework prioritizes patient well-being and regulatory adherence. Question 3. The audit findings indicate an unexpected increase in measured dose at a specific point within a water phantom during routine quality assurance testing of a megavoltage photon beam. This deviation is localized and not consistent with a general beam output fluctuation. Considering the primary mechanisms of radiation interaction with matter at these energies, which of the following is the most likely physical phenomenon contributing to this anomaly? Option A, pair production. Option B, Compton scattering. Option C, Rayleigh scattering. Option D, photoelectric effect. The correct answer is B, Compton scattering. Explanation: scenario analysis. This scenario presents a professional challenge by requiring the radiation therapist to interpret and apply knowledge of radiation matter interactions in a practical, quality assurance context. The challenge lies in identifying the most likely cause of an unexpected dosimetric reading, which could have implications for patient safety and treatment accuracy. It necessitates a deep understanding of fundamental physics principles as they relate to clinical practice and regulatory compliance. Correct approach analysis. The correct approach involves recognizing that Compton scattering is a dominant interaction mechanism for the energy ranges typically used in radiation therapy, e.g., megavoltage photons. Compton scattering involves the interaction of a photon with an atomic electron, resulting in the photon losing energy and changing direction, and the electron being ejected. In a phantom or tissue, this scattered radiation can contribute to the overall dose distribution, particularly in regions distal to the primary beam. An unexpected increase in dose in a specific area, especially if it's a region where Compton scatter is expected to be significant, points towards a potential issue with the beam's interaction characteristics or the measurement setup that is amplifying or misinterpreting this scatter. This aligns with the emphasis on understanding the physical principles underlying radiation therapy for safe and effective practice, as outlined in their examination content specifications. Incorrect approaches analysis. One incorrect approach would be to immediately assume a malfunction of the linear accelerator's primary beam generation components. While equipment malfunction is a possibility, it is not the most direct or likely explanation for a localized dosimetric anomaly that could be explained by fundamental radiation-matter interactions. Focusing solely on equipment failure without considering physics principles could lead to unnecessary and costly troubleshooting, delaying the identification of the actual cause. This bypasses the requirement for a thorough understanding of radiation physics, a core competency assessed by the AD. Another incorrect approach would be to attribute the anomaly solely to patient positioning errors. While patient positioning is critical for accurate dose delivery, a consistent and localized dosimetric deviation in a phantom during QA testing is less likely to be solely due to positioning, unless the phantom itself is being consistently mispositioned in a specific way that mimics a scatter effect. This approach neglects the fundamental physics of how radiation interacts with matter within the phantom, which is the primary focus of the question. It fails to address the underlying physical phenomenon. A third incorrect approach would be to dismiss the finding as within acceptable statistical variation without further investigation. While QA procedures account for statistical fluctuations, a significant and persistent deviation warrants investigation. Overlooking such findings could lead to undetected equipment issues or incorrect treatment delivery, violating the AD mandate for ensuring patient safety and quality care through rigorous assessment and understanding of radiation therapy principles. This demonstrates a failure to apply critical thinking and a lack of diligence in quality assurance. Professional reasoning. Professionals should approach such scenarios by first considering the most fundamental and likely explanations based on established physical principles. In radiation therapy, understanding how radiation interacts with matter is paramount. When faced with unexpected dosimetric results, the decision-making process should involve 1. Reviewing the expected physical interactions for the given energy and beam configuration. 2. Considering potential sources of error in measurement or equipment. And 3. Systematically investigating the most probable causes, starting with those rooted in fundamental physics. This analytical approach ensures that investigations are efficient, accurate, and ultimately contribute to patient safety and treatment efficacy, aligning with the professional standards expected by the AD. Question 4. The evaluation methodology shows that when planning radiation therapy for a patient with a brain tumor, the radiation therapist must consider the differential radiosensitivity of various organ systems. Which of the following considerations is most critical for ensuring patient safety and minimizing long-term morbidity? Option A. Prioritizing dose delivery to the temporal lobes over the spinal cord, as temporal lobe damage can be more immediately apparent. Option B. Maximizing dose to the pituitary gland to potentially enhance tumor response, even if it exceeds typical tolerance levels. Option C. Minimizing dose to the optic nerves and brainstem, which are highly radiosensitive and critical for vision and vital functions. Option D. Focusing on the overall treatment volume without specific attention to individual organ dose constraints, assuming the linear accelerator's safety features will suffice. The correct answer is C. Minimizing dose to the optic nerves and brainstem, which are highly radiosensitive and critical for vision and vital functions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the radiation therapist to apply their understanding of organ system radiosensitivity to a clinical situation where patient safety and treatment efficacy are paramount. Misinterpreting or misapplying knowledge of radiosensitivity can lead to suboptimal treatment planning, increased risk of side effects, and potential long-term harm to the patient. The challenge lies in translating theoretical knowledge into practical, patient-centered care within the strict regulatory framework of the radiation therapy exam. Correct approach analysis. The correct approach involves prioritizing the protection of highly radiosensitive organs that are critical for patient survival and quality of life. This aligns with the fundamental principles of radiation oncology, which aim to maximize tumor control while minimizing dose to surrounding normal tissues. The radiation therapy exam emphasizes the importance of understanding these principles to ensure safe and effective patient care. Specifically, the focus on minimizing dose to organs like the spinal cord, brainstem, and optic nerves, which have a low tolerance and can lead to severe, irreversible damage, reflects best professional practice and adherence to established radiation safety guidelines. Incorrect approaches analysis. An approach that prioritizes the treatment of less radiosensitive organs over highly radiosensitive ones, even if those less sensitive organs are closer to the tumor, represents a significant regulatory and ethical failure. This would violate the principle of ALARA, as low as reasonably achievable, for dose to normal tissues and could lead to unacceptable toxicity. It demonstrates a lack of understanding of the differential radiosensitivity of various tissues and organs, which is a core competency tested by the AD. Another incorrect approach would be to focus solely on achieving the prescribed tumor dose without adequate consideration for the dose delivered to critical organs, regardless of their radiosensitivity. This approach disregards the established dose constraints for organs at risk and could result in severe, dose-limiting toxicities, directly contravening regulatory requirements for patient safety and ethical obligations to prevent harm. A third incorrect approach might involve making treatment decisions based on anecdotal evidence or personal preference rather than established scientific principles and clinical guidelines regarding organ radiosensitivity. This is professionally unacceptable as it deviates from evidence-based practice and the standardized knowledge base expected of certified radiation therapists, potentially leading to inconsistent and unsafe patient care. Professional reasoning. Professionals should approach such situations by first identifying all critical organs within or adjacent to the treatment volume. Next, they must consult established dose constraints and tolerance levels for these organs, taking into account their known radiosensitivity. This information is typically found in treatment planning guidelines and institutional protocols. The treatment plan should then be optimized to meet the prescribed tumor dose, while ensuring that the dose to critical organs remains within acceptable limits, prioritizing the protection of the most radiosensitive and vital structures. This systematic approach ensures adherence to regulatory standards, ethical principles, and best practices in radiation therapy. Question 5. Market research demonstrates that patient anxiety can significantly impact treatment delivery in radiation therapy. A patient is exhibiting extreme distress and is verbally expressing fear and discomfort, making it difficult to maintain their position for accurate treatment delivery. The radiation therapist has attempted verbal reassurance and minor repositioning, but the patient's distress is escalating. According to the radiation therapy exam's regulatory framework, what is the most appropriate course of action for the radiation therapist? Option A. Inform the patient that treatment cannot proceed and send them home until they are able to remain still. Option B. Administer a mild sedative that is kept in the department for staff use to help calm the patient. Option C. Immediately pause treatment. Consult with the radiation oncologist to discuss potential pharmacological interventions for patient sedation and document the patient's distress and the consultation. Option D. Proceed with treatment as quickly as possible to minimize the patient's exposure time, even if it means compromising precise positioning. The correct answer is C. Immediately pause treatment. Consult with the radiation oncologist to discuss potential pharmacological interventions for patient sedation and document the patient's distress and the consultation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the radiation therapist to balance the immediate need for patient comfort and cooperation with the fundamental, non-negotiable principles of radiation safety. The patient's distress could lead to movement, compromising treatment accuracy and potentially increasing radiation exposure to unintended areas. However, any deviation from established safety protocols, even with good intentions, carries significant risks and regulatory implications. The therapist must exercise sound judgment, prioritizing patient well-being without compromising safety standards. Correct approach analysis. The correct approach prioritizes immediate patient safety and adherence to established radiation safety principles. This involves a systematic, multifaceted strategy that addresses the patient's distress while maintaining control over the radiation environment. By first attempting non-pharmacological interventions, and then, if necessary, involving the physician for appropriate sedation, the therapist ensures that patient comfort is addressed without compromising the integrity of the treatment delivery or the safety of personnel. This aligns with the ALARA, as low as reasonably achievable, principle, which mandates minimizing radiation exposure to patients and staff. Furthermore, it reflects the professional responsibility to maintain accurate treatment delivery, which is a cornerstone of patient care and regulatory compliance under the AT framework. Incorrect approaches analysis. One incorrect approach involves proceeding with treatment despite the patient's significant distress and potential for movement. This directly violates the principle of accurate treatment delivery and could lead to compromised efficacy and increased radiation dose to unintended tissues, failing to uphold the ALARA principle. It also disregards the patient's immediate well-being, which is an ethical concern. Another incorrect approach is to immediately abort the treatment and send the patient home without further assessment or intervention. While patient comfort is important, abandoning treatment without exploring solutions or consulting with the medical team is unprofessional and could negatively impact the patient's treatment plan and outcomes. This demonstrates a failure to apply problem-solving skills within the established clinical and regulatory framework. A third incorrect approach is to administer unauthorized medication to calm the patient. This is a severe regulatory and ethical violation. Radiation therapists are not authorized to prescribe or administer medications. Doing so constitutes practicing outside the scope of their license and could have dangerous consequences for the patient, leading to significant legal and professional repercussions. Professional reasoning. Professionals facing this situation should employ a decision-making framework that begins with patient assessment, followed by a tiered approach to problem solving. This involves 1. Assess the situation, understand the cause and severity of the patient's distress. 2. Prioritize safety, ensure all radiation safety protocols are maintained. 3. Explore non-invasive solutions, attempt communication, reassurance, and positioning adjustments. 4. Consult and escalate. If non-invasive methods fail, consult with the physician or other appropriate healthcare professionals for further management, such as pharmacological intervention. 5. Document. Thoroughly document all observations, interventions, and consultations. This systematic approach ensures that patient care is optimized while adhering to all regulatory requirements and ethical obligations. Question 6. The efficiency study reveals that a new Advanced Treatment Planning System, TPS, has been acquired for the Radiation Oncology Department. To ensure patient safety and treatment accuracy, which of the following approaches best aligns with professional best practices and regulatory expectations for implementing this new TPS? Option A. Immediately integrate the new TPS into all patient treatments to leverage its advanced features and improve throughput. Option B. Rely solely on the vendor's pre-installation testing and documentation for assurance of the TPS's accuracy and functionality. Option C. Prioritize rapid implementation by assuming staff familiarity with previous systems will translate to proficiency with the new TPS, minimizing downtime. Option D. Implement the new TPS through a phased approach, including rigorous independent verification of dose calculations and treatment plans using phantoms and established benchmarks, alongside comprehensive staff training. The correct answer is A. Immediately integrate the new TPS into all patient treatments to leverage its advanced features and improve throughput. Explanation. Scenario analysis. This scenario presents a common challenge in radiation therapy departments where the implementation of new technology, like an Advanced Treatment Planning System, TPS, requires a thorough evaluation of its impact on clinical workflow and patient safety. The challenge lies in balancing the potential benefits of improved accuracy and efficiency with the risks associated with unfamiliarity, potential system errors, and the need for comprehensive staff training. Ensuring that the TPS meets all regulatory requirements for accuracy, dose calculation, and data management is paramount. As mandated by the American College of Radiology, ACR, Practice Parameters, and the American Association of Physicists in Medicine, OPPM, task group reports, which are foundational for radiation therapy exam content. Correct approach analysis. The correct approach, which involves a phased implementation with rigorous independent verification of dose calculations and treatment plans against established benchmarks and phantom studies, represents best professional practice. This aligns with exam expectations by emphasizing a commitment to patient safety and adherence to established quality assurance protocols. Specifically, it reflects the principles outlined in the ACR practice parameters for radiation oncology, which mandate independent verification of treatment plans. This systematic approach ensures that the TPS performs as expected, minimizing the risk of under- or overdosing patients due to system inaccuracies. It also allows for the identification and correction of any workflow inefficiencies before widespread adoption, thereby upholding the professional responsibility to deliver safe and effective radiation therapy. Incorrect approaches analysis. One incorrect approach involves immediately integrating the new TPS into all patient treatments without prior validation. This is a significant regulatory and ethical failure because it bypasses essential quality assurance steps required by professional bodies and regulatory oversight. It directly contravenes the principle of ensuring the accuracy and reliability of treatment delivery, potentially leading to patient harm. Such an action would be considered a breach of professional duty and could violate guidelines from organizations like the ACR and OPPM, which are implicitly tested on the exam. Another incorrect approach is to rely solely on the vendor's pre-installation testing without conducting independent verification. While vendor testing is important, it is not a substitute for independent, site-specific quality assurance. Regulatory bodies and professional organizations expect healthcare providers to perform their own due diligence. Failure to do so represents a lapse in professional responsibility and a potential failure to meet the standards of care expected in radiation oncology. A third incorrect approach is to prioritize speed of implementation over thoroughness, assuming that staff familiarity with previous systems will translate directly to proficiency with the new TPS. This overlooks the critical differences in algorithms, user interfaces, and data management that can exist between systems. It is a failure to acknowledge the potential for new errors and the necessity for dedicated training and validation, which are crucial for maintaining patient safety and operational integrity. Professional reasoning. Professionals faced with implementing a new TPS should adopt a structured, evidence-based approach. This involves 1. Understanding the regulatory and professional standards for treatment planning and quality assurance. 2. Developing a comprehensive validation plan that includes independent verification of dose calculations and plan delivery using phantoms and established protocols. 3. Implementing a phased rollout, starting with a limited number of cases or specific treatment sites, to identify and address any issues in a controlled environment. 4. Providing thorough and ongoing training for all staff involved in treatment planning and delivery. 5. Establishing clear communication channels for reporting and resolving any encountered problems. This systematic process ensures that patient safety remains the highest priority while leveraging the benefits of new technology. Question 7. Market research demonstrates a new radiation therapy planning technique that promises significantly improved dose distribution for a specific patient population. However, implementing this technique requires modifications to the current treatment planning system and potentially new quality assurance procedures. What is the most appropriate course of action for a radiation therapy department to take when evaluating this new technique? Option A. Implement the new technique using existing QA procedures and provide minimal on-the-job training to staff to expedite its integration. Option B. Immediately implement the new planning technique across all relevant patient cases to leverage its purported benefits as quickly as possible. Option C. Conduct a thorough review of the technique's scientific validity, assess its compatibility with existing equipment and QA protocols, and develop a plan for rigorous testing and validation before widespread adoption. Option D. Reject the new technique without further investigation, as it deviates from established and familiar treatment planning methods. Correct answer is C. Conduct a thorough review of the technique's scientific validity, assess its compatibility with existing equipment and QA protocols, and develop a plan for rigorous testing and validation before widespread adoption. Explanation. Scenario analysis. This scenario presents a common implementation challenge in radiation therapy, balancing the desire for improved dose distribution, as suggested by market research on advanced planning techniques, with the practical constraints of existing equipment and established clinical protocols. The professional challenge lies in evaluating new technologies and methodologies not just for their theoretical benefits, but for their safe, effective, and compliant integration into patient care. This requires a deep understanding of radiation physics, treatment planning principles, regulatory requirements, and the potential impact on patient outcomes and institutional resources. Correct approach analysis. The correct approach prioritizes a systematic, evidence-based evaluation process that aligns with AD and established radiation therapy practice guidelines. This involves a thorough review of the proposed technique's scientific merit, its compatibility with current equipment and quality assurance, CA protocols, and its potential to demonstrably improve dose distribution without compromising patient safety or introducing unacceptable risks. This approach ensures that any change is well justified, rigorously tested, and implemented in a manner that adheres to regulatory standards for patient care and radiation safety, as expected by the AD. Incorrect approaches analysis. One incorrect approach involves immediately adopting the new technique based solely on market research and the promise of improved dose distribution. This bypasses essential steps of validation and risk assessment, potentially leading to the use of unproven or incompatible technology, which violates the principle of providing safe and effective patient care as mandated by regulatory bodies overseeing radiologic technologists. It also fails to consider the need for appropriate training and quality assurance, which are critical for maintaining the integrity of the treatment process. Another incorrect approach is to dismiss the new technique outright without any investigation, simply because it represents a change from current practice. This can stifle innovation and prevent the adoption of potentially beneficial advancements that could improve patient outcomes. It demonstrates a lack of professional curiosity and a failure to engage with evolving best practices in radiation therapy, which could be seen as a dereliction of the duty to provide the highest standard of care. A third incorrect approach is to implement the new technique without adequate staff training or updated quality assurance procedures. This creates a significant risk of treatment errors, incorrect dose delivery, and potential harm to patients. It directly contravenes regulatory requirements for proper equipment operation, patient safety, and the ongoing competency of radiation therapy professionals. Professional reasoning. Professionals should approach such implementation challenges by first understanding the proposed innovation's theoretical basis and potential benefits. This should be followed by a comprehensive assessment of its practical applicability within the existing clinical environment, considering equipment capabilities, staff expertise, and established QA protocols. A pilot study or phased implementation, coupled with rigorous data collection and analysis, is often advisable. Crucially, all decisions must be grounded in patient safety, efficacy, and compliance with all applicable regulations and professional standards, as expected by the AD. Question 8. Strategic planning requires a radiation therapist to accurately assess the potential risks associated with different forms of energy used in healthcare. When evaluating the fundamental difference between radiation types for patient care and safety protocols, which of the following distinctions is most critical for a radiation therapist to understand? Option A. The perceived intensity or brightness of the radiation. Option B. The duration of exposure to the radiation. Option C. The ability of the radiation to cause ionization in biological tissues. Option D. The source of the electromagnetic spectrum from which the radiation originates. The correct answer is C. The ability of the radiation to cause ionization in biological tissues. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a radiation therapist to differentiate between two broad categories of radiation based on their fundamental interaction with biological tissues, a distinction critical for patient safety and treatment efficacy. Misunderstanding this difference can lead to inappropriate patient management, potential harm, or ineffective treatment planning. The challenge lies in applying theoretical knowledge to a practical risk assessment context. Correct approach analysis. The correct approach involves recognizing that ionizing radiation, by definition, possesses sufficient energy to remove electrons from atoms and molecules, thereby directly or indirectly causing cellular damage. This property is the basis for radiation therapy's therapeutic effect, but also its potential toxicity. Understanding this mechanism is paramount for risk assessment, as it dictates the necessary safety precautions, treatment parameters, and potential side effects that must be considered. This aligns with the fundamental principles of radiation safety and therapeutic application, as governed by the American Registry of Radiologic Technologists (AT) standards, which emphasize a thorough understanding of radiation physics and biology. Incorrect approaches analysis. One incorrect approach would be to equate the energy levels of all forms of electromagnetic radiation without considering their interaction with matter. This fails to acknowledge the defining characteristic of ionizing radiation, its ability to ionize, which is the basis for its biological effects, and the stringent safety protocols required in radiation therapy. This oversight represents a failure to adhere to the core principles of radiation physics and safety, mandated by regulatory bodies like the AT. Another incorrect approach would be to focus solely on the source of radiation, without considering its energy and potential to cause ionization. For instance, assuming all radiation from medical imaging equipment is inherently non-ionizing or vice versa, without understanding the specific type and energy of the radiation emitted, would be a critical error. This demonstrates a lack of understanding of the fundamental physics of radiation and its classification, which is a prerequisite for safe and effective practice as outlined by AT guidelines. A further incorrect approach would be to assume that the biological effects of radiation are solely dependent on the duration of exposure, irrespective of whether the radiation is ionizing or non-ionizing. While exposure time is a factor in dose, it does not alter the fundamental nature of the radiation itself. Non-ionizing radiation, even at prolonged exposures, does not possess the energy to cause ionization and the associated cellular damage characteristic of ionizing radiation. This demonstrates a misunderstanding of the primary mechanism of harm for ionizing radiation, a critical concept for risk assessment in radiation therapy. Professional reasoning. Professionals should approach this by first identifying the type of radiation being considered. Then, they must recall the defining characteristic of ionizing radiation, its ability to cause ionization in biological tissues. This understanding directly informs the risk assessment by dictating the potential for cellular damage, the need for shielding, dose limitations, and the management of treatment-related side effects. The AT emphasizes this foundational knowledge for all radiologic technologists, including those specializing in radiation therapy, to ensure patient safety and competent practice. Question 9. Cost-benefit analysis shows that implementing a rapid patient setup protocol using only the most superficial, easily palpable bony landmark for daily treatment verification could significantly reduce patient treatment times. However, this approach may not account for subtle anatomical shifts or the precise location of internal target volumes. Considering the AT emphasis on accurate treatment delivery and patient safety, which of the following approaches best balances efficiency with the critical requirement for precise anatomical targeting? Option A. Utilize a combination of bony and soft tissue landmarks, cross-reference with daily imaging verification, to ensure accurate patient positioning and treatment field alignment. Option B. Use a single, deep bony landmark that is difficult to palpate but assumed to be more stable without daily imaging verification. Option C. Rely solely on the most superficial, easily palpable bony landmark for daily setup, assuming it adequately represents the target volume for efficiency. Option D. Prioritize speed by performing a quick visual check of the patient's general position without specific landmark verification, trusting the initial simulation setup. The correct answer is A. Utilize a combination of bony and soft tissue landmarks, cross-reference with daily imaging verification, to ensure accurate patient positioning and treatment field alignment. Explanation. Scenario analysis. This scenario presents a common challenge in radiation therapy where the precision of anatomical landmark identification directly impacts treatment efficacy and patient safety. The challenge lies in balancing the need for accurate targeting with the practical limitations of patient positioning and inherent anatomical variability. Misidentification of landmarks can lead to underdosing critical structures or overdosing healthy tissues, both of which have significant clinical consequences and potential regulatory implications related to patient care standards. The cost-benefit analysis mentioned in the question implies a need to consider efficiency and resource allocation, but this must never compromise the fundamental requirement for accurate treatment delivery as mandated by AD standards and general radiation oncology principles. Correct approach analysis. The correct approach emphasizes the use of multiple, well-defined anatomical landmarks, cross-referenced with imaging, to establish the treatment field. This aligns with the AD emphasis on radiation therapists' responsibility for accurate patient positioning and treatment delivery. The rationale is that relying on a single landmark can be prone to error due to patient movement, anatomical variations, or observer subjectivity. Utilizing a combination of bony and soft tissue landmarks, verified by imaging, e.g., portal imaging, CBCT, provides a robust method for ensuring the radiation beam is precisely delivered to the intended target volume, thereby upholding the ethical and professional standard of care. This approach minimizes the risk of treatment errors and ensures compliance with established protocols for quality assurance in radiation therapy. Incorrect approaches analysis. One incorrect approach involves solely relying on a single, easily palpable bony landmark without further verification. This is professionally unacceptable because it ignores the inherent variability in patient anatomy and positioning. A single landmark may not accurately represent the entire target volume, especially in cases of significant soft tissue involvement or when the target is deep-seated. This approach risks significant geographic misses, leading to undertreatment of the tumor or irradiation of unintended critical structures, which constitutes a failure to meet the standard of care and could be a violation of regulatory guidelines concerning patient safety and treatment accuracy. Another incorrect approach is to prioritize speed of setup over meticulous landmark verification, especially when imaging is readily available. While efficiency is desirable, it cannot supersede the accuracy required for radiation therapy. Delaying or skipping verification steps, even if the initial landmark identification appears correct, introduces a significant risk of error. This disregard for verification procedures, particularly when imaging is a standard tool for quality assurance, represents a failure to adhere to best practices and could be interpreted as negligence, violating the professional and ethical obligations to the patient. A third incorrect approach might involve using landmarks that are not consistently identifiable or are prone to significant variation between patients or even within the same patient over time. For example, relying solely on superficial soft tissue landmarks that can fluctuate with respiration or patient hydration, without correlating them with more stable bony structures or imaging data. This lack of reliability in landmark selection increases the probability of positioning errors and compromises the integrity of the treatment plan, again failing to meet the professional standard of care. Professional reasoning. Professionals should adopt a systematic approach to patient positioning. This involves first identifying the primary anatomical landmarks as defined in the treatment plan. Next, these landmarks should be cross-referenced with imaging data e.g., simulator films, CT scans, or in-room imaging, to confirm their accuracy and the correct placement of the radiation beams. If discrepancies arise, the therapist must not proceed with treatment until the issue is resolved, consulting with the radiation oncologist or medical physicist as necessary. This iterative process of identification, verification, and correction ensures that the treatment is delivered as prescribed, safeguarding patient well-being and adhering to regulatory requirements for safe and effective radiation therapy. The decision-making process should always prioritize patient safety and treatment accuracy, with cost-benefit considerations being secondary to these fundamental principles. Question 10. System analysis indicates that during a routine patient treatment session, a radiation therapist observes a subtle but consistent deviation in the beam's isodose distribution displayed on the in-room monitor compared to the expected pattern derived from the treatment planning system. The technologist has confirmed the patient positioning and immobilization are correct. What is the most appropriate immediate course of action to ensure patient safety and treatment integrity? Option A. Continue the treatment at the prescribed dose rate, assuming the deviation is a minor display artifact, and document the observation for review at a later time. Option B. Immediately pause the treatment and initiate a comprehensive diagnostic check of the linear accelerator's beam delivery system, including verification of monitor unit calculations and output constancy, while consulting the machine's service logs for any recent maintenance or error reports. Option C. Immediately adjust the machine's output calibration settings to match the observed deviation, believing this will correct the discrepancy. Option D. Stop the treatment and immediately contact the medical physicist to report the observed deviation without performing any preliminary checks. The correct answer is B. Immediately pause the treatment and initiate a comprehensive diagnostic check of the linear accelerator's beam delivery system, including verification of monitor unit calculations and output constancy, while consulting the machine's service logs for any recent maintenance or error reports. Explanation. Scenario analysis. This scenario presents a professional challenge related to the safe and effective operation of a linear accelerator, a critical piece of equipment in radiation therapy. The challenge lies in identifying the root cause of an observed anomaly during treatment delivery and determining the appropriate course of action. This requires a deep understanding of the linear accelerator's components, their functions, and the potential implications of malfunctions on patient safety and treatment efficacy. The technologist must balance the need for immediate patient care with the imperative to adhere to established safety protocols and regulatory requirements. Correct approach analysis. The correct approach involves a systematic investigation of the linear accelerator's components and operational parameters. This aligns with the American Registry of Radiologic Technologists (AT) standards, which emphasize the technologist's responsibility for safe and accurate treatment delivery. Specifically, it reflects the AT focus on understanding the physics and operation of radiation therapy equipment. By consulting the machine's log files, checking the integrity of the beam delivery system, and verifying the accuracy of the treatment planning system's parameters against the machine's output, the technologist is engaging in a process of quality assurance and safety verification. This methodical approach ensures that any deviation from expected performance is identified and addressed before it can compromise patient treatment or safety, adhering to principles of ALARA, as low as reasonably achievable, and patient well-being. Incorrect approaches analysis. Continuing treatment without investigation is a direct violation of patient safety protocols and AT ethical guidelines. It assumes the anomaly is insignificant, which could lead to underdosing or overdosing the patient, rendering the treatment ineffective or causing harm. This approach disregards the fundamental principle of verifying treatment parameters. Immediately escalating to a physicist without performing basic checks is inefficient and potentially unnecessary. While physicist involvement is crucial for complex issues, a technologist is expected to perform initial troubleshooting steps to isolate the problem. This approach bypasses the technologist's role in quality assurance and can lead to delays in patient care if the issue is resolvable by the technologist. Adjusting treatment parameters based on subjective observation without objective data or verification is highly dangerous and unethical. This bypasses established quality assurance procedures and the integrity of the treatment plan, directly jeopardizing patient safety and treatment accuracy. It is a failure to adhere to the established protocols for safe and effective radiation therapy delivery. Professional reasoning. When faced with an operational anomaly in a linear accelerator, a radiation therapist should follow a structured decision-making process. This process begins with immediate patient safety assessment. Next, the technologist should consult the machine's operational logs and perform visual inspections of accessible components. If the anomaly persists or is unclear, a systematic verification of treatment parameters against machine output should be conducted, referencing the treatment plan and machine specifications. If the issue cannot be resolved through these steps, or if there is any doubt regarding patient safety or treatment accuracy, the appropriate next step is to immediately involve the medical physicist. This tiered approach ensures patient safety, efficient problem-solving, and adherence to regulatory requirements. Question 11. Stakeholder feedback indicates a need for clearer understanding of how radiation therapy causes cellular injury. Considering the primary mechanisms of radiation damage at the cellular level, which of the following best describes the most significant contributor to cellular damage in a typical aerobic tissue environment treated with external beam radiation therapy? Option A. The depletion of intracellular oxygen levels due to radiation exposure. Option B. The direct ionization of cellular macromolecules, particularly DNA. Option C. The formation of free radicals through the radiolysis of water, leading to indirect damage. Option D. The activation of cellular apoptosis pathways by radiation-induced signaling cascades. The correct answer is B. The direct ionization of cellular macromolecules, particularly DNA. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the radiation therapist to interpret and apply complex cellular radiobiology principles to a patient care situation, bridging theoretical knowledge with practical application. The challenge lies in accurately identifying the primary mechanism of radiation damage relevant to the observed clinical outcome, ensuring that treatment decisions are informed by a sound understanding of radiobiological effects and align with established exam content expectations. Correct approach analysis. The correct approach directly addresses the fundamental mechanisms of radiation damage at the cellular level, specifically focusing on the direct and indirect effects of ionizing radiation. This aligns with the radiation therapy exam's emphasis on understanding how radiation interacts with biological tissues to produce therapeutic and detrimental effects. Recognizing that indirect damage via free radical formation is a significant contributor to cellular injury is crucial for comprehending radiation's overall impact and for developing effective treatment strategies. This understanding is foundational to radiation therapy practice and is a core competency assessed by the Incorrect approaches analysis. One incorrect approach might overemphasize DNA repair mechanisms as the primary damage mechanism. While DNA repair is a critical cellular process, it is a response to damage, not the initial mechanism of damage itself. Focusing solely on repair, without acknowledging the initial insult, would be a misapplication of radiobiological principles and would not accurately reflect the primary cause of cellular injury. This fails to demonstrate a comprehensive understanding of radiation's interaction with cells, a key area for assessment. Another incorrect approach might incorrectly identify only direct DNA damage as the sole mechanism. While direct DNA damage is a component, it is not the entirety of radiation's cellular impact. Ionizing radiation's interaction with water molecules to produce free radicals, indirect damage, is a substantial contributor to cellular damage, particularly in the presence of oxygen. Neglecting this significant pathway demonstrates an incomplete understanding of radiation biology, which is a critical deficiency for certification. A third incorrect approach might focus on macroscopic tissue effects without delving into the underlying cellular mechanisms. While understanding macroscopic effects is important for patient management, the exam specifically tests the understanding of cellular-level interactions. Failing to connect macroscopic observations to the fundamental cellular processes of radiation damage would represent a failure to meet the exam's core objectives. Professional reasoning. Professionals should approach such scenarios by first recalling the fundamental principles of radiation biology as outlined in approved study materials. This involves understanding the different types of radiation interactions with matter and their subsequent biological consequences at the cellular level. When faced with a clinical observation, a professional should systematically consider the primary mechanisms of radiation damage, direct action on critical cellular molecules like DNA, and indirect action through the radiolysis of water, leading to free radical formation. The professional should then evaluate which mechanism best explains the observed cellular response, considering factors like the presence of oxygen and the type of radiation used. This systematic, principle-based approach ensures that the interpretation is accurate, clinically relevant, and aligned with the knowledge expected for certification. Question 12. Risk assessment procedures indicate that a patient undergoing radiation therapy for head and neck cancer reports a new onset of severe dry mouth and difficulty swallowing, which began approximately 2 weeks into their treatment course. The radiation plan involves a dose of 70 Gi to the primary tumor and involved lymph nodes, with significant dose spillage to the parotid glands and pharyngeal constrictors. Patient denies any fever or other signs of infection. Which of the following is the most appropriate initial clinical action? Option A. Prescribe broad-spectrum antibiotics to rule out an occult infection contributing to the symptoms. Option B. Immediately reduce the radiation dose to the affected areas to alleviate the symptoms. Option C. Advise the patient that these symptoms are expected side effects of radiation and will resolve after treatment completion. Option D. Perform a thorough oral examination, assess hydration status, and review the radiation dose distribution to the salivary glands and pharynx. The correct answer is D. Perform a thorough oral examination, assess hydration status, and review the radiation dose distribution to the salivary glands and pharynx. Explanation. Scenario analysis. This scenario presents a professional challenge because the patient's symptoms are subjective and can be attributed to multiple causes, including radiation-induced normal tissue reactions, pre-existing conditions, or unrelated illnesses. Differentiating between these requires a thorough understanding of radiation biology, clinical presentation, and patient history, as well as adherence to established clinical protocols for managing treatment side effects. The challenge lies in accurately assessing the cause of the symptoms to ensure appropriate and timely patient care, thereby minimizing potential harm and optimizing treatment outcomes. Correct approach analysis. The correct approach involves a systematic clinical evaluation that prioritizes patient safety and evidence-based practice. This includes a detailed patient history, a comprehensive physical examination, and a review of the treatment plan and dose distribution. The goal is to correlate the patient's reported symptoms with known patterns of normal tissue response to radiation at the irradiated site and dose level. This aligns with the professional responsibility to monitor patients during and after radiation therapy, as mandated by standards of care and regulatory guidelines that emphasize patient well-being and the management of treatment-related toxicities. This approach ensures that interventions are targeted and effective, preventing unnecessary complications or delays in care. Incorrect approach is analysis. One incorrect approach is to dismiss the patient's symptoms as minor or expected side effects without a thorough investigation. This fails to acknowledge the potential for significant normal tissue damage or other underlying medical issues, which could lead to delayed diagnosis and treatment of more serious conditions. Ethically, this approach breaches the duty of care owed to the patient. Another incorrect approach is to immediately adjust the radiation therapy plan based solely on subjective complaints without objective assessment or correlation with dose distribution. This could lead to undertreatment of the tumor or unnecessary escalation of radiation dose, potentially increasing the risk of long-term complications without a clear clinical indication. This deviates from established protocols for treatment modification and patient management, which require careful consideration of all factors. A further incorrect approach is to attribute the symptoms solely to psychological factors without a comprehensive medical workup. While psychological distress can accompany cancer treatment, it should not be the primary or sole explanation for physical symptoms without ruling out organic causes. This overlooks the physiological impact of radiation and can lead to inadequate medical management. Professional reasoning. Professionals should employ a structured decision-making process that begins with active listening to the patient's concerns. This is followed by a systematic data collection phase, including history and physical examination, and then an analysis of the data in the context of the patient's radiation therapy plan and known radiobiology. The process involves differential diagnosis, considering both radiation-induced effects and other potential causes. Based on this comprehensive assessment, an individualized management plan is developed, which may include symptomatic treatment, further diagnostic tests, or modifications to the radiation therapy. This iterative process ensures that patient care is evidence-based, patient-centered, and compliant with professional standards and regulatory requirements. Question 13. Assessment of a radiation therapist's contouring process for a patient with a newly diagnosed head and neck tumor reveals that they primarily relied on the initial diagnostic CT scan, did not consult the treatment planning physician for clarification on ambiguous nodal boundaries, and contoured the optic chiasm based on a general anatomical landmark, rather than precise imaging delineation. Which of the following represents the most appropriate and professionally responsible approach to contouring in this scenario? Option A. Integrate all available imaging modalities, consult with the treating physician for any ambiguities, and precisely delineate critical structures based on their visualization on the imaging dataset. Option B. Proceed with contouring based on personal experience and established habits, as this ensures consistency in the therapist's own workflow. Option C. Rely on the initial diagnostic CT scan as the primary source for contouring, as it is typically used for treatment planning. Option D. Contour critical structures based on general anatomical knowledge to save time, as precise delineation is often not critical for these structures. The correct answer is A. Integrate all available imaging modalities, consult with the treating physician for any ambiguities, and precisely delineate critical structures based on their visualization on the imaging dataset. Explanation. Scenario analysis. This scenario presents a common challenge in radiation therapy, where the precise delineation of the target volume and critical structures is paramount for effective treatment and patient safety. The challenge lies in interpreting complex imaging data, understanding anatomical variations, and applying established contouring guidelines to ensure accurate dose delivery while minimizing toxicity to surrounding healthy tissues. The need for meticulous accuracy is amplified by the potential for significant clinical consequences, including undertreatment of the tumor or severe side effects from irradiating sensitive organs. Correct approach analysis. The correct approach involves a systematic and collaborative process, adhering strictly to established institutional protocols and guidelines for contouring. This includes careful review of all available imaging modalities e.g., CT, MRI, PET, utilizing appropriate contouring atlases or consensus guidelines, and engaging in peer review or physician consultation when ambiguity exists. This method ensures that the target volume encompasses the entire known extent of the disease, while critical structures are accurately identified and delineated to remain within dose constraints. This aligns with the emphasis on professional responsibility, patient safety, and the application of knowledge in clinical practice, ensuring compliance with standards of care. Incorrect approaches analysis. One incorrect approach involves relying solely on a single imaging modality without cross-referencing or considering other available data. This can lead to inaccuracies in target volume definition or critical structure identification due to the inherent limitations of each imaging technique. This failure to utilize all available diagnostic information represents a lapse in professional diligence and could violate standards of care, potentially leading to suboptimal treatment outcomes or increased toxicity, which is contrary to the principles of safe and effective radiation therapy practice. Another incorrect approach is to contour based on assumptions or personal preferences without consulting established protocols or seeking clarification. This subjective approach introduces variability and increases the risk of errors, undermining the consistency and reproducibility required in radiation therapy. Such a deviation from standardized procedures can be considered a failure to adhere to professional guidelines and could compromise patient safety, a core ethical and regulatory concern. A third incorrect approach is to contour critical structures without considering their functional significance or potential for dose-limiting toxicity. This superficial contouring fails to appreciate the clinical implications of dose to these organs. Best practice requires a thorough understanding of radiobiology and the impact of radiation on specific tissues, ensuring that contouring decisions are clinically informed and prioritize patient well-being. As expected by professional standards, professional reasoning, professionals should approach contouring by first understanding the specific clinical scenario and treatment intent. They must then systematically review all relevant imaging, applying established contouring guidelines and protocols. When faced with uncertainty, seeking consultation with experienced colleagues or the treating physician is essential. This iterative process of review, application of knowledge, and collaboration ensures the highest level of accuracy and patient safety, reflecting the professional commitment to evidence-based practice and ethical patient care. Question 14. Comparative studies suggest that variations in the anatomical presentation of the diaphragm's position relative to the liver can significantly impact radiation therapy planning for upper abdominal malignancies. A radiation therapist is tasked with setting up a patient for treatment. Which of the following methods best ensures accurate localization of the treatment field based on internal anatomy, adhering to best practices in radiation therapy? Option A. Relying on the patient's subjective report of discomfort or pressure to infer the location of internal organs. Option B. Adjusting the treatment field based on the patient's breathing pattern observed during setup, without direct reference to imaging. Option C. Confirming the position of the diaphragm and liver solely by palpating external abdominal landmarks and comparing them to a standard anatomical chart. Option D. Utilizing cross-sectional imaging, e.g., CT simulation scans, to precisely identify the superior and inferior borders of the diaphragm and the superior border of the liver, and then correlating these with the planned treatment field margins. The correct answer is C. Confirming the position of the diaphragm and liver solely by palpating external abdominal landmarks and comparing them to a standard anatomical chart. Explanation. Scenario analysis. This scenario presents a professional challenge by requiring the radiation therapist to accurately identify anatomical landmarks for treatment planning, directly impacting patient safety and treatment efficacy. Misidentification can lead to underdosing or overdosing critical structures, potentially causing treatment failure or severe side effects. The challenge lies in the subtle differences between anatomical structures and the need for precise localization, especially in complex regions. Correct approach analysis. The correct approach involves utilizing established imaging protocols and cross-referencing anatomical knowledge with the patient's specific imaging. This aligns with the radiation therapy exam's emphasis on the practical application of anatomy and physiology in treatment delivery. Best professional practice dictates that radiation therapists must possess a thorough understanding of cross-sectional anatomy as visualized on CT, MRI, and other imaging modalities used for simulation and treatment planning. This ensures accurate delineation of the target volume and organs at risk, adhering to the principle of delivering radiation precisely as prescribed by the radiation oncologist. Regulatory compliance is met by following established quality assurance procedures and maintaining competency in anatomical identification, which is fundamental to safe and effective radiation therapy practice as outlined by professional standards and implied by certification requirements. Incorrect approaches analysis. One incorrect approach involves relying solely on superficial external landmarks without verifying with internal anatomy on imaging. This is a significant regulatory and ethical failure because it bypasses the fundamental requirement for precise localization based on internal structures, which are the true determinants of target volume and organ at-risk positioning. It increases the risk of treatment errors and violates the professional duty of care. Another incorrect approach is to assume consistency in anatomical presentation across different patients, even with similar external presentations. This is a failure because anatomical variations are common, and each patient's anatomy must be assessed individually. Relying on assumptions rather than direct visualization and verification on imaging leads to potential misalignments and compromised treatment. A third incorrect approach is to delegate the final verification of internal anatomical landmarks to a less experienced team member without direct supervision or independent verification by the licensed radiation therapist. This is a regulatory and ethical failure, as it compromises the chain of responsibility for patient safety and treatment accuracy. The radiation therapist holds ultimate responsibility for the accurate delivery of radiation, which begins with correct patient setup based on verified anatomical landmarks. Professional reasoning. Professionals should approach patient setup by first reviewing the treatment plan and associated imaging. They should then identify key internal anatomical structures on the simulation images that define the target and critical organs. External landmarks should be used as a guide, but always verified against the internal anatomy visualized on the imaging. A systematic approach, involving cross-referencing, independent verification, and adherence to established protocols, is crucial for ensuring patient safety and treatment accuracy. This decision-making process is guided by the focus on clinical competence and the ethical imperative to provide safe and effective patient care. Question 15. Process analysis reveals that during routine quality assurance checks of a linear accelerator, a specific beam output measurement consistently registers 1.5% lower than the established baseline value. This deviation has been observed over the past 3 daily checks. What is the most appropriate immediate course of action for the radiation therapist? Option A. Document the deviation in the equipment logbook and continue with scheduled patient treatments, as the deviation is within typical daily fluctuations. Option B. Immediately notify the medical physicist of the consistent deviation and consult the linear accelerator's quality assurance manual for established tolerance limits. Option C. Attempt to recalibrate the linear accelerator's output to the baseline value independently to ensure treatment accuracy. Option D. Monitor the equipment for another week to gather more data before reporting the deviation to ensure it is a persistent issue. Correct answer is A. Document the deviation in the equipment logbook and continue with scheduled patient treatments, as the deviation is within typical daily fluctuations. Explanation. Scenario analysis. This scenario presents a common challenge in radiation therapy quality assurance, identifying and rectifying subtle equipment performance deviations that could impact patient treatment accuracy. The professional challenge lies in distinguishing between minor, transient fluctuations and potentially significant drifts that necessitate immediate action, balancing the need for timely patient care with the imperative of maintaining treatment integrity. The technologist must apply their understanding of equipment physics, clinical tolerance levels, and regulatory requirements to make an informed decision. Correct approach analysis. The correct approach involves a systematic investigation that begins with verifying the consistency of the observed deviation across multiple measurements and potentially different operational modes of the linear accelerator. This aligns with the principles of quality assurance mandated by regulatory bodies such as the Nuclear Regulatory Commission, NRC, and state agencies, which require regular performance testing and documentation. Specifically, the American Registry of Radiologic Technologists, AT, exam emphasizes the technologist's role in recognizing and reporting deviations from established performance parameters. By consulting the equipment's quality assurance manual and established clinical tolerance limits, the technologist can determine if the observed deviation exceeds acceptable thresholds. If it does, the next critical step is to immediately notify the medical physicist, as per established protocols and regulatory guidelines, to ensure prompt evaluation and corrective action. This ensures patient safety and adherence to the ALARA principle by preventing potentially inaccurate treatments. Incorrect approaches analysis. Failing to verify the consistency of the deviation before reporting it is problematic because it may lead to unnecessary downtime and investigations for a transient or artifactual issue, disrupting patient workflow without a clear justification based on established QA protocols. This approach lacks the systematic problem-solving expected in a regulated environment. Ignoring the deviation because it appears minor or has not yet resulted in a patient treatment error is a significant regulatory and ethical failure. The AT exam and regulatory frameworks emphasize proactive identification and correction of potential issues to prevent future errors. Waiting for a clinical manifestation of the problem violates the principle of preventing harm and could be construed as negligence. Attempting to recalibrate the equipment without consulting the medical physicist or the manufacturer's service manual is a direct violation of established QA procedures and potentially regulatory requirements. Unauthorized adjustments can lead to unintended consequences, further compromising equipment performance and patient safety. This bypasses the expertise of the qualified medical physicist and the established chain of command for equipment maintenance and repair. Professional reasoning. Professionals should approach such situations by first adhering to established quality assurance protocols. This involves systematic data collection, comparison against established benchmarks, tolerance limits, and clear communication with the appropriate personnel. The decision-making process should prioritize patient safety and regulatory compliance, following a hierarchical approach. Observe, verify, compare to standards, and escalate to the responsible expert medical physicist if deviations exceed acceptable limits. Understanding the specific requirements of the AT certification, which includes knowledge of equipment operation and QA, is paramount. Question 16. To address the challenge of accurately simulating a patient for radiation therapy when standard immobilization devices may not provide sufficient stability due to unique anatomical considerations, which simulation technique and approach best ensures reproducible patient positioning and accurate treatment planning? Option A. Utilizing a standard simulator with generic immobilization aids, assuming they will suffice for most patients. Option B. Employing a CT simulator with custom-designed immobilization devices tailored to the patient's specific anatomy and treatment position. Option C. Relying on diagnostic CT scans performed without radiation therapy-specific immobilization, as they provide detailed anatomical information. Option D. Performing simulation using only plain film radiography to capture the treatment field, as it is a simpler imaging method. Correct answer is B. Employing a CT simulator with custom-designed immobilization devices tailored to the patient's specific anatomy and treatment position. Explanation. Scenario analysis. This scenario presents a professional challenge in ensuring accurate and reproducible patient positioning for radiation therapy, which is paramount for delivering the prescribed dose to the target volume while minimizing dose to surrounding healthy tissues. The challenge lies in selecting the most appropriate simulation technique when faced with a patient whose anatomy may not be ideally suited for standard immobilization devices, requiring a nuanced understanding of imaging modalities and their application in radiation therapy planning. Careful judgment is required to balance patient comfort, immobilization effectiveness, and the diagnostic quality of the simulation, images for accurate contouring and treatment planning. Correct approach analysis. Utilizing a CT simulator with appropriate immobilization devices tailored to the patient's specific needs, such as custom-made thermoplastic masks or supports, represents best professional practice. This approach aligns with the fundamental principles of radiation therapy, emphasizing accurate patient setup and reproducible positioning. The American Registry of Radiologic Technologists, AT, Standards of Practice and Code of Ethics underscore the technologist's responsibility to provide quality patient care, which includes selecting appropriate simulation techniques that ensure treatment accuracy and patient safety. A CT simulator provides the necessary high-resolution cross-sectional data for 3D treatment planning. Custom immobilization ensures that the patient can be reproducibly positioned in the same way for each treatment fraction, a critical requirement for effective radiation delivery and adherence to the treatment plan. Incorrect approaches analysis. Using a standard simulator without considering patient-specific immobilization needs fails to adequately address the challenge of reproducible positioning, potentially leading to treatment inaccuracies and increased dose to critical structures. This neglects the professional responsibility to optimize patient setup. Relying solely on diagnostic CT scans obtained without the context of radiation therapy immobilization devices can result in inaccurate target and organ at-risk delineation due to differences in patient positioning and the absence of treatment-specific immobilization. This deviates from best practices for simulation in radiation oncology. Employing simulation techniques that do not provide adequate anatomical detail for precise contouring, such as plain film radiography for primary treatment planning, is insufficient for modern radiation therapy and would not meet the diagnostic requirements for accurate dose calculation and delivery. This represents a failure to utilize appropriate imaging technology for the intended purpose. Professional reasoning. Professionals should approach simulation technique selection by first assessing the patient's individual needs and the specific treatment site. This involves considering the required level of immobilization, the potential for patient movement, and the anatomical region being treated. The chosen technique must provide diagnostic quality imaging suitable for accurate contouring of the target volume and organs at risk. The technologist must then select the most appropriate imaging modality and immobilization devices that facilitate reproducible patient positioning throughout the course of treatment, always prioritizing patient safety and treatment efficacy in accordance with ACT guidelines and established clinical protocols. Question 17. Governance review demonstrates a radiation therapist is managing a patient experiencing acute skin changes and reporting fatigue during a course of external beam radiation therapy. The therapist understands that radiation can cause both deterministic effects, which are dose-dependent and have a threshold, and stochastic effects, which are probabilistic and increase in likelihood with dose. Considering the added emphasis on patient safety and understanding of radiation biology, what is the most appropriate approach for the radiation therapist in this situation? Option A. Prioritize a detailed discussion with the patient about the molecular mechanisms of DNA damage and cellular repair pathways to ensure a complete understanding of radiation biology before addressing symptoms. Option B. Advise the patient that fatigue is a common, nonspecific symptom, and the skin changes are likely unrelated to radiation therapy, as the focus should remain on delivering the prescribed treatment dose. Option C. Immediately reduce the radiation dose to all patients undergoing similar treatment protocols to minimize any potential for both deterministic and stochastic effects. Option D. Focus on immediate management of the observed skin changes and fatigue as potential deterministic effects, while also educating the patient about the probabilistic nature of long-term stochastic risks. Correct answer is D. Focus on immediate management of the observed skin changes and fatigue as potential deterministic effects, while also educating the patient about the probabilistic nature of long-term stochastic risks. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the radiation therapist to interpret and apply complex biological principles of radiation effects in a practical, patient-centered context, while adhering to strict regulatory guidelines for patient safety and treatment efficacy. The challenge lies in balancing the understanding of deterministic and stochastic effects with the immediate need to manage patient symptoms and ensure the integrity of the treatment plan, all within the framework of AT regulations. Correct approach analysis. The correct approach, focusing on the immediate management of deterministic effects and the long-term monitoring for stochastic effects, represents best professional practice. This aligns with the AT emphasis on patient care and safety, which necessitates understanding the dose-response relationships of radiation. Deterministic effects, such as skin erythema or mucositis, are directly related to the dose received and are predictable. Managing these symptoms promptly is a direct patient care responsibility. Stochastic effects, like the increased risk of secondary malignancies, are probabilistic and depend on factors beyond immediate treatment management, but require informed patient communication and long-term surveillance, reflecting a commitment to the patient's overall well-being and adherence to ethical radiation oncology principles. Incorrect approaches analysis. An approach that solely focuses on minimizing all radiation exposure without considering therapeutic benefit would be incorrect. While radiation safety is paramount, the therapeutic intent of radiation therapy is to deliver a prescribed dose to eradicate cancer. Overly cautious reduction of dose without clinical justification would compromise treatment efficacy and violate the fundamental principles of radiation oncology, potentially leading to treatment failure and a worse patient outcome. This would be a failure to adhere to the prescribed treatment plan, a core ethical and professional responsibility. An approach that dismisses patient-reported symptoms as unrelated to radiation therapy without proper investigation would be a significant regulatory and ethical failure. AT guidelines and professional ethics mandate that radiation therapists actively assess and respond to patient symptoms. Ignoring potential radiation-induced effects, whether deterministic or stochastic, can lead to delayed or inadequate symptom management, causing patient suffering and potentially impacting treatment adherence. This demonstrates a lack of diligence and patient advocacy. An approach that prioritizes the theoretical understanding of radiation biology over immediate patient comfort and symptom management would also be incorrect. While a deep understanding of biological effects is crucial, the practical application in patient care demands that immediate needs, such as pain or discomfort from deterministic effects, are addressed promptly. Delaying symptom relief in favor of abstract biological discussion would be a failure in compassionate care and could negatively impact the patient's quality of life during treatment. Professional reasoning. Professionals should approach such situations by first prioritizing immediate patient well-being. This involves a thorough assessment of reported symptoms and correlating them with expected radiation effects based on the treatment plan and dose delivered. The next step is to implement appropriate interventions for managing deterministic effects, consulting with the radiation oncologist as needed. Simultaneously, professionals must maintain an awareness of the potential for stochastic effects, ensuring proper documentation and patient education regarding long-term risks. This systematic approach ensures that both immediate care and long-term safety are addressed, in accordance with AT standards and ethical practice. Question 18. The evaluation methodology shows a radiation therapist reviewing a patient's treatment plan and noticing a significant discrepancy between the physician's initial written prescription for a specific dose and the dose generated by the treatment planning system. The therapist is unsure which value is correct and how to proceed. Option A. Proceed with the treatment as generated by the treatment planning system, assuming it is the most current and accurate representation of the plan. Option B. Immediately inform the physicist and the prescribing physician of the discrepancy and await their clarification before proceeding with any treatment. Option C. Inform only the physician of the discrepancy and ask for their guidance on how to proceed. Option D. Independently adjust the treatment plan parameters to match the physician's written prescription without further consultation. Correct answer is B. Immediately inform the physicist and the prescribing physician of the discrepancy and await their clarification before proceeding with any treatment. Explanation. The evaluation methodology shows a scenario where a radiation therapist is faced with conflicting information regarding a patient's treatment plan, specifically concerning the prescribed dose, and the physician's initial intent versus the final plan generated by the treatment planning system. This situation is professionally challenging because it directly impacts patient safety and the integrity of the prescribed treatment. The therapist is ethically and professionally obligated to ensure the treatment delivered is accurate and safe, and this requires vigilance in verifying all aspects of the plan. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols for plan verification. By immediately bringing the discrepancy to the attention of the physicist and physician, the therapist is acting as a critical checkpoint in the treatment delivery process. This aligns with the fundamental principles of radiation oncology, which emphasize meticulous quality assurance and communication. The American Registry of Radiologic Technologists, AT, Standards of Ethics, and the Code of Conduct mandate that radiologic technologists act in the best interest of the patient, which includes identifying and reporting potential errors or deviations from the prescribed plan. This proactive communication ensures that any inaccuracies are identified and corrected before treatment commences, thereby preventing potential harm to the patient. An incorrect approach of proceeding with treatment based on the assumption that the system-generated plan is correct represents a significant ethical and regulatory failure. It bypasses the crucial verification step and places undue trust in technology without critical human oversight. This violates the principle of do no harm and the professional responsibility to ensure the accuracy of treatment delivery. Furthermore, it could be seen as a failure to adhere to institutional policies and procedures for treatment plan review, which are typically designed to prevent such errors. Another incorrect approach of only informing the physician without involving the physicist is also problematic. While physician notification is essential, the physicist plays a critical role in the technical aspects of treatment planning and verification. The physicist is responsible for ensuring the plan is technically sound and accurately reflects the physician's prescription. Excluding the physicist from this initial communication delays the resolution of a technical discrepancy and potentially prolongs the period of uncertainty regarding the patient's treatment. This failure to involve the appropriate personnel in a timely manner can compromise the quality assurance process. Finally, an incorrect approach of making an independent decision to adjust the plan without consulting the physician or physicist is a severe breach of professional conduct and regulatory guidelines. Radiation therapy is a team-based discipline, and treatment plans are developed and verified collaboratively. Independent modification of a prescribed dose or treatment technique by a therapist without proper authorization and review is outside the scope of practice and poses a direct risk to the patient. This action undermines the established hierarchy of responsibility and the critical checks and balances designed to ensure patient safety. The professional decision-making process in such situations should involve a systematic approach. 1. Identify the discrepancy or potential error. 2. Consult relevant documentation, prescription, treatment plan, imaging. 3. Communicate the concern clearly and promptly to the appropriate team members, starting with the most immediate point of contact for verification, often the physicist and the prescribing physician. 4. Document all communications and actions taken. 5. Do not proceed with treatment until the discrepancy is resolved and the plan is verified as accurate and safe. Question 19. Market research demonstrates that patients undergoing radiation therapy for pelvic malignancies often present with anatomical variations that can obscure critical structures on superficial examination. A radiation therapist is preparing a patient for treatment and finds that the iliac crest, a commonly used external landmark for defining the superior border of the pelvic treatment field, is not clearly palpable due to the patient's body habitus. The therapist needs to ensure accurate positioning for effective tumor targeting and organ sparing. Which of the following approaches best ensures the integrity of the treatment plan and patient safety in this scenario? Option A. Estimate the position of the iliac crest based on the patient's overall body size and shape and adjust the treatment field accordingly. Option B. Utilize cross-sectional imaging, such as a CT simulation scan, to precisely identify the internal anatomical location of the target volume and critical structures, and base the treatment field borders on these internal references. Option C. Proceed with treatment using the last known accurate positioning from a previous treatment session, assuming no significant anatomical changes have occurred. Option D. Rely solely on palpation of other external bony landmarks, such as the pubic symphysis, and assume the internal anatomy aligns with standard anatomical atlases. The correct answer is B. Utilize cross-sectional imaging, such as a CT simulation scan, to precisely identify the internal anatomical location of the target volume and critical structures, and base the treatment field borders on these internal references. Explanation. Scenario analysis. This scenario presents a common challenge in radiation therapy where a patient's anatomical landmarks for treatment planning are obscured by overlying structures. Accurately identifying and delineating these critical structures is paramount for delivering a precise radiation dose to the target volume while sparing healthy tissues. Failure to do so can lead to undertreatment of the tumor, resulting in treatment failure or overtreatment of critical organs, causing severe acute or long-term toxicity. The professional challenge lies in integrating imaging information with anatomical knowledge to make an informed decision about the most reliable method for landmark identification. Correct approach analysis. The correct approach involves utilizing cross-sectional imaging, such as CT or MRI, to visualize the internal anatomy and precisely locate the target volume and critical structures. This method is supported by the American Registry of Radiologic Technologists. Radiation therapy exams emphasis on the application of physics, biology, and anatomy in treatment planning and delivery. Standards implicitly require the use of the most accurate and reliable methods available for patient positioning and dose calculation, which directly relies on precise anatomical identification. Utilizing cross-sectional imaging ensures that the treatment plan is based on the patient's individual anatomy, aligning with the principles of evidence-based practice and patient safety, mandated by regulatory bodies overseeing medical imaging and radiation therapy in the U.S. Incorrect approaches analysis. Relying solely on external anatomical landmarks without cross-referencing internal structures is a significant regulatory and ethical failure. U.S. regulations, such as those from the Nuclear Regulatory Commission, NRC, and state radiation control programs, mandate that radiation therapy be delivered based on accurate treatment plans derived from patient-specific imaging. External landmarks can be unreliable due to variations in patient positioning, body habitus, and the presence of overlying tissues that may obscure the true location of internal structures. This approach risks inaccurate targeting, leading to potential harm to the patient, which violates the fundamental ethical principle of do no harm and the professional standard of care. Assuming the patient's anatomy is consistent with standard anatomical atlases without verifying with imaging is also a failure. While anatomical atlases are valuable learning tools, they represent generalized anatomy. Each patient is unique, and variations in organ position, size, and relationship to surrounding structures are common. The exam expects technologists to understand and apply patient-specific data. Ignoring this principle and proceeding with a plan based on generalized anatomy is a deviation from best practice and can lead to suboptimal treatment outcomes and increased toxicity, violating professional responsibilities and potentially contravening regulatory requirements for individualized patient care. Professional reasoning. Professionals should employ a systematic decision-making process that prioritizes patient safety and treatment efficacy. This involves 1. Thoroughly reviewing the patient's medical history and diagnostic imaging. 2. Identifying the primary treatment target and all relevant critical structures. 3. Assessing the quality and clarity of available imaging for landmark identification. 4. If internal structures are obscured or ambiguous on initial imaging, consult with the radiation oncologist and or medical physicist to determine the most appropriate imaging modality, e.g., diagnostic CT, MRI, PET-CT for accurate delineation. 5. Utilize cross-sectional imaging to precisely define the treatment field boundaries and critical organ margins. 6. Document all decisions and justifications for the chosen approach. This process ensures that treatment planning and delivery are based on the most accurate and up-to-date patient-specific anatomical information, adhering to professional standards and regulatory mandates. Question 20. Consider a scenario where a patient undergoing radiation therapy for a head and neck malignancy expresses significant anxiety and claustrophobia when presented with a custom-molded thermoplastic mask for immobilization. The physician's prescription requires precise immobilization of the head and neck region to ensure accurate dose delivery to the target volume and minimize dose to surrounding critical structures. As the radiation therapist, what is the most appropriate course of action to ensure both patient comfort and treatment efficacy? Option A. Inform the patient that their comfort is secondary to the accuracy of the treatment and that they must tolerate the mask as prescribed. Option B. Discuss the patient's concerns with the physician and explore alternative immobilization techniques or strategies to manage claustrophobia, such as shorter treatment sessions or the use of mild anxiolytics, while still ensuring adequate immobilization. Option C. Proceed with fitting the thermoplastic mask as prescribed, reassuring the patient that it is necessary for treatment accuracy and that they will get used to it. Option D. Utilize a less rigid, non-customized immobilization device that may be more comfortable but offers less precise control over patient positioning, assuming the slight variability is acceptable. Correct answer is B. Discuss the patient's concerns with the physician and explore alternative immobilization techniques or strategies to manage claustrophobia, such as shorter treatment sessions or the use of mild anxiolytics, while still ensuring adequate immobilization. Explanation. This scenario presents a common challenge in radiation therapy, balancing the need for precise patient immobilization with the patient's comfort and potential for claustrophobia, especially when using advanced immobilization devices. The challenge lies in ensuring the prescribed dose is delivered accurately while maintaining patient safety and dignity. Adhering to the standards set by the American Registry of Radiologic Technologists, AT, for radiation therapy practice. The correct approach prioritizes patient safety and treatment accuracy by utilizing a custom-molded thermoplastic mask that conforms precisely to the patient's facial anatomy. This method, when properly fitted and secured, provides excellent immobilization for head and neck treatments, minimizing patient movement and ensuring reproducible positioning. This aligns with AT emphasis on quality patient care and accurate treatment delivery, which are fundamental to the profession. The use of such devices requires a thorough understanding of their application and potential patient impact, demonstrating professional competence. An incorrect approach would involve using a standard, non-customized immobilization device that does not adequately secure the patient's head and neck, leading to potential inaccuracies in dose delivery. This fails to meet the professional standard of care and could result in undertreatment or overtreatment of the target volume, compromising the therapeutic outcome. Ethically, it neglects the responsibility to provide the best possible treatment. Another incorrect approach would be to disregard the patient's reported claustrophobia and forcefully apply an uncomfortable immobilization device without exploring alternatives or mitigation strategies. This demonstrates a lack of patient-centered care and could lead to patient distress, noncompliance, and compromised treatment. It violates the ethical principle of beneficence and non-maleficence by causing unnecessary suffering. A further incorrect approach would be to proceed with treatment using a less effective immobilization method due to time constraints or perceived inconvenience, without proper justification or documentation. This compromises the integrity of the treatment plan and the professional's commitment to delivering high-quality care as expected by the AT. It reflects poor professional judgment and a failure to uphold the standards of the profession. The professional decision-making process in such situations involves a systematic evaluation of the patient's needs, the treatment requirements, and the available immobilization options. It requires open communication with the patient to understand their concerns, followed by a collaborative decision-making process to select the most appropriate immobilization technique. This includes considering the use of alternative devices, patient education, and potentially sedation if medically indicated and appropriate, all while ensuring the chosen method meets the stringent requirements for accurate radiation delivery.